Have you ever noticed that your joints are painful or achy after antibiotics, stress, or even certain foods? That's not a coincidence. Most people think that joint pain starts in the joints, but in many cases, it starts in the gut. Your joints might be the smoke, but the fire is in your gut. And I've seen patients improve their symptoms just by supporting their gut health, even when all the medication stayed the same. In this video, I'm going to explain how, and I'll walk you through a simple 3-day reset that you can try to calm inflammation naturally. Just 3 days, you can do it. I'm Dr. Banasali, lifestyle medicine and rheumatologist doctor. Let's dive in. Have you ever noticed that your joints are painful or achy after antibiotics, stress, or even certain foods? That's not a coincidence. We used to think that joint pain was all mechanical. It was wear and tear, genetics, or even just getting older. But now we know that the gut plays a much bigger role. Inside your gut are trillions of bacteria that help regulate your immune system. When that balance is disrupted, it's something we call gut dysbiosis. That can lead to leaky gut, which allows molecules that cause inflammation, like LPS, into your bloodstream. This can cause havoc and trigger your immune system. And in some people, the joints are the first place that this shows up. Here's the surprising part. Gut symptoms don't always come first. Some people who have early gut issues, like dysfunction in the gut, they feel perfectly fine digestively, no issues with their stomach or pain, but they start having inflammation in other places like the joints or the skin. And in early rheumatoid arthritis, which is an immune disease, researchers have found a high level of a very specific bacteria called Prevotella copri. We're still learning what that means, but it may suggest that the microbiome helps drive the disease even before any symptoms appear. We're also seeing a similar pattern in osteoarthritis, the wear and tear arthritis, especially in people who are overweight, obese, or have metabolic syndrome. The inflammation that's starting in the gut can be accelerating the breakdown of cartilage in the joints. So here's my quick tip number 1. If you've taken multiple rounds of antibiotics or are eating a lot of ultra-processed foods or even have a very low fiber diet, you may already have signs of dysbiosis in your gut, even if your digestion actually feels fine. So what are some warning signs that it may really be active inflammation instead of just wear and tear at your joints? If you're having stiffness in your joints for more than an hour, if you're having a lot of brain fog, fatigue, that's not really making sense. If you're having swelling in a lot of different areas at the joint, so not like the whole hand or the whole foot, but in very specific joint areas. Or if you're having a lot of pain after a stressful episode, after you've been sick a while, or even if you've been eating kind of all of these highly processed foods. These signs may reflect a systemic process or inflammation, just widespread inflammation, not just wear and tear in the joints. So here's my quick tip number 2. Keep a symptom tracker for a week or 2. And in there, you want to log meals, sleep, stress levels, pain. You might start seeing a connection between what you eat or how you feel emotionally and how your joints behave. And what if you don't have a formal diagnosis of arthritis? You just feel really stiff and achy. That could still be low-grade inflammation linked to gut health. Gut dysbiosis, it can trigger systemic immune changes long before you see anything on your lab work or even on x-rays. And remember, the gut also talks to the brain. It's talking. And inflammation in the gut can increase your pain sensitivity and affect mood and fatigue. This is something we see in chronic pain syndromes like fibromyalgia. Quick tip here, even if your blood work is normal, try supporting your gut. Focus on fiber-rich foods, better sleep, and stress reduction. These symptoms, they can still ease those vague symptoms of inflammation that a lot of people are feeling. This is where lifestyle medicine becomes powerful, because if you make these changes, this is supporting your microbiome, and that affects inflammation. One of the most exciting findings in recent years was a Stanford study that showed by adding fermented foods like kimchi, yogurt, sauerkraut, kefir, they can reduce inflammatory markers like IL-6 and improve gut diversity. Because we're seeing in different people when they get certain medications, they respond differently depending on what their gut looks like, the microbiome and the diversity in their gut. It makes a difference. But here's the nuance. If you have an autoimmune disease or gut sensitivity, it can be tough to take in fermented foods. So my next quick tip is start low and go slow. Begin with just a teaspoon of sauerkraut or a small amount of miso broth and just see how your body responds to that. For sensitive people, you can have well-strained kefir or low histamine ferments, and they can often be a lot more tolerable. And you can also feed your good gut bacteria by eating a variety of plant foods. Aim for at least 30 different types per week if you can. So whether you have a diagnosis of arthritis or just unexplained joint pain, don't just look at the symptoms. You want to look at the cause. So let's talk about a reset. For the next 3 days, cut out ultra-processed foods and sugary drinks. Add 2 extra servings of fiber-rich foods, specifically vegetables and whole grains, and prioritize about 7 to 8 hours of sleep. Just 3 days, you can do it. Even this tiny little shift can help inflammation. And if you know somebody that needs these practical tips on how to heal your body from inside out, please share. I'm Dr. Banasali with Plant Forward MD. I'll see you next time.